I am Dr. Roopesh Jain, a consultant physician and diabetologist from Chennai, and I am having almost 18 years of experience in this field. So friends, today we will be speaking about understanding hypertension. So what is exactly hypertension, how to check BP and how to prevent it? All this thing we will be discussing today. Generally we all know that everyone says, doctor, I am having high blood pressure or low blood pressure. So what exactly does it mean? Basically each time when the heart beats, pumps your heart, so you can say my heartbeat is 75 or 80 everything. So when you have, for this pumping heart you need to have certain pressure. That's why we always tell that BP is high or low. So normally in a healthy heart BP should be around 120/80 millimeters of mercury. But when this BP goes above this level, okay, it like a level above more than 130/90 or 140/90, it becomes hypertension. So when this why we have so much importance of hypertension, and we say that hypertension is a silent killer. What happens is when this high BP is left untreated for a long time, it can lead to certain complications like cardiac disease or your stroke. So this heart attacks, stroke are silent killers, we all know, and hypertension is one of the risk factors for such problems. So usually BP develops over a period of time. What happens is as your age grows, the arteries become stiffened. So for that you would require extra pressure to pump your heart, and this pressure is because of your hypertension. So what happens is, here we say that what are the risk factors for hypertension? So we have certain modifiable and non-modifiable risk factors. What are these non-modifiable risk factors? First thing is your family history. So we can't change your genetics. So family history has one important role in hypertension. If you tell that my grandfather or father had hypertension, you are at more risk of getting hypertension. So family history is one of the most important risk factor for your hypertension. These are like non-modifiable risk factor. Next comes your age. Age can't be modified. As you grow older and older, your arteries become stiffened, which can also one of the modifiable risk factor for your heart, blood pressure. Next comes your modifiable risk factors, the lifestyle. Today's, westernized lifestyle, junk foods, smoking, alcohol, these all things can cause increase in blood pressures. How this diet pattern causes your blood pressure to be elevated? Today's world, we are like, initially you can just ask your grandparents, we used to eat fresh food, but today's world, we eat all this preserved food, all the packet junk food, like you starting from your idli, chapati, rice, everything comes in packed version, like all these MTR foods, like packet food. When you travel, you all get packet food, everything. This all contains certain amount of preservatives which are not good for health. Recently there's an article, they say that Maggi contains a lot of lead and chromium, which are all carcinogenic. So any packed food is one of the risk factors for hypertension, heart disease and cholesterol also. Today morning I was reading one newspaper and we found out that out of 4 people, 1 person is supposed to be hypertensive and diabetic without that knowledge also. So you can see there's almost 25% increase in risk factor for all these diseases. How this happens? Because of today's westernized lifestyle, lack of physical activities, increased consumption of alcohol, smoking, etc. Can all these things. Apart from this, stress is one of the major factor for your diseases. So there is something called as metabolic syndrome. What is this metabolic syndrome? We have these 5 important factors for the metabolism. One is your hypertension, obesity, increased cholesterol, increased blood sugar levels, and increased cholesterol levels. Among these 5, any 2 risk factors can cause metabolic syndrome. And metabolic syndrome is one of the most important risk factors for cardiac diseases. What diseases like heart attacks, strokes, everything can be caused by this syndrome. And among this, hypertension is one of the most important factor for metabolic syndrome. So moving on. Hypertension doesn't have any symptoms. Like usually there may be some symptoms for any diseases, but hypertension per se initial stage there won't be any symptoms. What symptoms? Like doctor, I'm not having my BP is high, but I'm not symptomatic. So what happens is initial days when you're young you may not have any symptoms, but as the BP becomes persistently high you may have some symptoms like early morning giddiness, sometimes you get irritable, you have headache in the morning or nausea, vomiting. This all can be a silent symptom for hypertension. So, early diagnosis is very important in management of hypertension. How do you diagnose hypertension? Usually I tell my patients, after age of 40 years, please go for one early master checkup yearly once. What is this master checkup? Check your BP, especially not by this electronic meter. Check by a routine golden sphygmomanometer by a doctor. And when your BP is high, usually don't tell your hypertension. At least check BP thrice in a week on 3 consecutive days. If still BP is more than 140/90, then you can be labeled as hypertensive. Apart from this, next is your other routine checkups. What checkup? Your cholesterols, like lipid profile, your hemogram, your kidney test, thyroid, everything. So yearly once have a complete set of checkup, which includes your treadmill, echo, everything. This is very, very important for your prevention. I always tell my patients, if you can invest 10,000 rupees on prevention yearly once, you can prevent long-term complications like heart attack and stroke. So you can, friends, always go to your physician, do one routine checkup and go for the reports. At least we can do something on prevention. What prevention? Control BP, control cholesterol. For example, if your grandfather or father has any history of heart attacks or stroke, you can put you on primary medications which can prevent long-term complications. So next comes about this BP. And for this today's World Hypertension theme was measure your blood pressure, control it and live longer. What is live longer? Our aim should be not to live for 90 or 100 years. Our aim should be, even if you live for 80 or 90 years, you should live happy, healthy and productive. So next, how to prevent this? This risk of hypertension can be prevented by taking few steps. First is your regular exercise. Even if you can walk for 45 minutes per day, 5 days a week, which is more easier and easy to follow and free of cost. And nowadays every watch has some smart counting steps are available now. So if you can walk 5 to 7,000 steps per day, 5 days a week, that is more than enough. Coming to a healthy diet, avoid junk foods, avoid packet food, eat fresh cooked food, that is very, very important, and try to reduce junk food like cheese and butter things. Quit smoking, that's very, very important. Check your BP regularly and also avoid stress. Nowadays you can see everything online, you can just see how to reduce your stress. Go for regular walks, smile yourself, read positive books, do yoga, you can reduce your stress moment. Plus finally comes your medicines. Adherence to medicines is very, very important, because we have seen out of 10 patients coming to us, 5 patients stop medicine, 50%, 5% don't even start also. So if you can take something on prevention, you can actually prevent long-term diabetic complications. Plus how to do, now comes your exercise and physical activity. If you can walk for 20 to 30 minutes per day, it is more than enough for you. Next comes, what is this DASH diet? DASH diet is like, dietary approaches to stop hypertension, like reduce salt intake, because salt intake is one of the most important factors of hypertension. If you can reduce salt intake, don't take on top salt. For example, if you are taking some curd rice, just take don't take over salt on that. If you're taking salad, don't add salt on the salads. It's very easily possible. Next comes, you can eat whole grains, whole wheat, whole fresh vegetables, very, very important for DASH diets. And these all things have been proven to reduce blood pressure by almost 11 millimeters. Next comes direct, and any preservative is in the form of salt. So avoid this packed preserved food. You can always reduce salt intake easily. Next comes BP monitoring. Today's world, BP monitoring is very, very easy. Every app has some monitoring there. Plus, when you have doubt that my BP is high, please consult your general physician who can check your BP periodically and monitor medicines accordingly. Stress management you can do accordingly by you doing some yogas and everything. Finally, adherence to medicine, again I am telling you, very, very important, because if you can do something to prevent complication, that is very, very fruitful. Take one BP medicines if your BP is high, take something to reduce your cholesterol, take antiplatelet agents. This all thing can actually prevent long-term diabetic or hypertensive complications like stroke or heart attacks. So to summarize my talk today, friends, I would like to tell you a few important things. First thing is, diagnose your hypertension. If not there, prevent it. Check your BP periodically, follow strict diet, reduce alcohol intake, quit smoking, and also regularly you please take your medicines. If you can follow along, apart from your lifestyle modification, this can prevent long-term complication, hypertension, heart attacks also. Thank you very much.